science,
engineering,
medicine,
chemistry,
physics,
biology, humanities, cardiology,
computing, public health, global
aeronautics, science communication.
Hello everyone, I'm Gareth Mitchell. Today, mental health and well-being in young people in the midst of the pandemic. And there are tales of high drama and adventure in space.
One of the toughest times I had in space was when one of our antennae failed on the way to the space station and we had to perform a manual docking. Of course, we'd done it in the training before, but we had to trust each other with our lives.
Helen Sharman on teamwork and dealing with risk. She'll be comparing notes with a doctor on the front line treating emergency COVID-19 patients. And also on the theme of illness, serious enough to put people in hospital, a new study links severe morning sickness and depression. We'll have the details.
The Imperial College Podcast.
Yep, thanks for being here, folks. We're going to start with Kate Whiten. And Kate, this is an analysis that you're going to tell us about deaths during the pandemic. So can you just widen that out for us?
Yeah, thank you. So this is a new analysis looking at deaths during the first wave of the pandemic. And not just deaths from COVID-19, but deaths from all causes. Because as we know, not only does COVID cause the deaths from infection with the virus, but also it can have lots of knock-on effects on healthcare, on people's appointments being rescheduled, on perhaps their support network not being there as it was before. So the researchers really wanted to get an idea of the overall impact of the pandemic. And this was during the first wave. So it was mid-February to end of May. And they looked at 21 nations. And these were all high income nations who had weekly death data available. And after looking at this data, it did show that England, Wales and Scotland had among the highest total number of deaths during the first wave of the pandemic. And again, so total number of deaths is COVID deaths, but also deaths from all other causes, which does suggest that there was a big impact, as we know, on our nation, but also on healthcare support networks and all the other things that could impact someone's ongoing health condition.
Yeah, it's interesting, isn't it? Looking at these death figures, not just from the virus itself, but overall deaths, and indeed with those international comparisons. So I suppose, Kate, just before we let you go, what would you say would be the main take-home from this analysis so far?
Well, the authors had a number of key messages. So looking at the second wave, we obviously now are in the second wave, looking at anything we can do to ensure that the support networks for people who really need that support or who have ongoing conditions is maintained as much as possible. Something that they did also see is that the countries who had the least investment in their healthcare system over the past decade did fare worse in terms of overall deaths. So they had higher overall deaths. So for example, they looked at Austria that had per head of population 3 times as many hospital beds available as the UK. So having a forward looking approach, they really were talking about the importance of investment in a country's health system so that it's able to sustain and support its population in such unusual times such as these.
All right, Kate Whiten, thank you very much indeed for that. Well, now let's look ahead to some of the events and indeed mind-expanding activities that we have to look forward to from the Imperial community in the coming days and weeks. Ellie Cawthorah joins us. She's with the public engagement team. So, Ellie, what do we have to look forward to?
We have a lot to look forward to, Gareth. We're really excited that we've now launched the Great Exhibition Road Festival with some online content. It's under this umbrella term of Explore at Home, and we've kicked off with this wonderful project called Fantasies of Exhibition Road. This is where a group of artists have created this digital fantasy reimaginings of the road, the street that we call home. So the festival is a celebration of science and the arts and center of culture, discovery and innovation. And our festival really celebrates that and brings it to life.
And can you tell me about some of these artistic pieces?
Do you know what? It would be really nice to talk about some of these beautiful pieces that have been created. So Ian Davenport was a Turner Prize nominee, and he's done a beautiful, visually stunning, colourful piece where he's converted Exhibition Road into this flow of bright, vibrant rainbow colours. And there's another piece as well by a wonderful artist called Sadie Clayton, who works with copper. She's created this virtual copper mobile that sort of hangs above Exhibition Road. What we hope to do for the festival in 2021 is actually turn one of these into a reality and have it as an installation. So to see some of these in real life would just be mind-blowing. The work that these artists have done with no limits of the tangible world has just been really inspiring, and they're a fascinating piece to look at.
Where did these artists get some of their inspiration from for these pieces?
That's a great question, because they all had conversations with different mental health researchers at Imperial. So all these pieces are inspired by cutting edge science.
So Ellie, whilst we have you, of course, lots going on next week. So this podcast goes out on Wednesday, the 21st of October. So for the keenies who are listening to us soon after download, we have a week of events to look forward to as of, I guess, Monday the 26th. So what's going on there?
Yeah, absolutely. So we run our Imperial Lates, events for adults that take place across the last week of every month. This month, we're going to be exploring the science and research behind well-being, kicking off with exploring mental health in Black men, and then we're looking at sleep science. So you can ask any question you like to our sleep scientists. And then we're going to be really having a look at what we can do for ourselves now that the days are getting so much shorter and there's a potential looming lockdown. We've got some really nice speakers to talk about how, from the science perspective, we can cope with looking after our mental well-being in this difficult time.
So finally, and really importantly, these are free events, so that's cool, but we do like people to sign up for them. So how can you find out where to sign up?
Absolutely. So for Imperial Lates, please head to the Imperial website. And then for the Great Exhibition Road Festival, search that into your social media platform of choice and give us a follow.
There you go. Really easy to find. Great Exhibition Road Festival. Marvellous. Ellie, thank you so much indeed. Have a good series of events. Really looking forward to them. And we'll get you back on the podcast soon.
Thank you.
So Ellie was talking there about well-being of the mind as well as the body, and indeed, earlier this month was World Mental Health Day. So we thought we'd focus on younger people and mental health, especially in the context of the pandemic. Justine Alford is Communications Manager at the Institute of Global Health Innovation. She's been speaking to Lindsay Dewa, a research fellow in public and mental health, who's working on a research project called COPE.
The aim of COPE, so defined as COVID-19 coping in young people, was to find out how young people's mental health and coping styles during and after COVID lockdown was experienced. So importantly, we wanted to co-produce the study with young people with experience of mental health difficulties throughout all research stages.
How did this study come about? What actually motivated you?
So we knew early on in COVID-19 lockdown, so back in March, that it might have an effect on young people's mental health. We just didn't know where to focus our research. We developed 11 research questions, and around 80 people took part in the exercise to decide which one was important to them. We found that one in particular was to look at young people's mental health and how they were coping during the lockdown.
Okay, and so how did you go about finding out about how the lockdown is affecting young people's mental health? What did you do with the young people?
Yeah, back in March, we went through ethics to produce a survey. We worked with young people throughout each research stage, so conducting the interviews online and analysing the interviews and interpreting the survey data online. And then we co-produced the output. So this included a blog and paper that is currently under review at the moment. And then we'll be able to see if their mental health and coping strategies have changed over time. And we'll also be following up a subsample of those people who have done month 6 to actually explore a bit more in detail why they've reported certain things in the survey.
I was just wondering, did you have any prior assumptions about the kind of things that you might find out in this research?
That's an interesting question. I probably expected that most young people would have some sort of issue or some sort of experience of poor mental health during the lockdown. And I think that's mainly because of my understanding of social isolation in relation to poor mental health, and we know that there's a relationship between those two things, and also in relation to different coping strategies. But I also think we have to understand that young people are quite resilient as well. So I did think that there'd be other pockets of the young people that would have coped okay, they were resilient, they were all right. We just didn't know how they were coping. So that was still something real question for me, like how were they coping during lockdown? What sort of methods were they using? And that was really great to find that out during the course of the study.
And has what you found out so far married up with your prior expectations?
I was shocked to find that around 10% of young people had self-harmed during lockdown, and they all had poor mental health, so there was a relationship there. And around 30% actually self-harmed before lockdown, which did marry up with the stats. Also, I guess I didn't expect that around 25% had poor mental health. I thought it would be a lot higher than that, to be honest. And we expected distraction strategies, for example, to be deemed in a negative way, but actually distraction was actually more associated with good mental health. It seemed that the young people were actually distracting themselves in different ways to be able to cope during lockdown. Those sorts of things that came out there were things like having a routine, taking the dog out for a walk, watching Netflix, cleaning, cooking, all these things that really just distracted them. And that really did come out in the interviews, actually, all these different examples of the ways they were coping. That was something unexpected, but I think they've all been doing as well as they can do during this time.
Well, it's good to hear that sometimes distraction can be a positive thing. So thinking about next steps, Lindsay, how might your research be applied?
Yeah, so I think there's some real good learning here. So even though lockdown has worsened young people's mental health to an extent, the resilience is coming through self-management strategies. So they are being able to cope in different ways. But all of these learnings, other people don't know how to do. So I feel like now we're living in a digital world, these strategies can be translated into a digital world. So whether it's a workshop online that, 10 ways to have a better night's sleep, or different ways to actually maintain a routine, or, building in exercise that's part of your new normal. I think, education and sort of education sectors, universities have a real role to play in this and can actually really facilitate that at a really low cost in a way that they can provide that sort of support, especially when face-to-face is limited, so we can bring in digital alternatives.
Lindsay Dewa speaking there to Justine Alford. Well, now the thrills, frustrations and risks of spaceflight and how those relate to medicine at the sharp end. We bring you now a fascinating conversation between astronaut and cosmonaut Helen Sharman and trainee surgeon Derek Yeung. The Hidden Strengths podcast brought the two together to compare notes on the emotional challenges and personal experiences that they've faced in their careers. The podcast comes from PanSurge, a hub of surgeons and related professionals at Imperial College. The team has very kindly let us take some excerpts from this wide-ranging, heart-rending and honest exchange between the space pioneer and the medical practitioner. We join the conversation on the subject of teamwork, as Helen recalls an especially memorable episode on Soyuz.
One of the toughest times I had in space was when one of our antennae failed on the way to the space station and we had to perform a manual docking. The three of us inside Soyuz had to basically operate together as one team. Of course, we'd done it in the training before, but we had to trust each other with our lives. And having made that docking, that relief and that wonderful feeling of togetherness, and in the end, actually, it wasn't what we had done, but that we had done it. It was that team, that camaraderie.
Really right about the team thing. I remember, so when we first got to intensive care, there were obviously patients there already. In a quite strange way, unless you were there from the beginning, you feel a bit detached from the patients because you weren't there when they were awake. The first patient where we saw as a team in the beginning, they came to intensive care and then they eventually got better and we were able to wake them up from the ventilator and we were there when they woke up and smiled at us. As you say, we felt like we've achieved something all together.
Do you get a chance to talk, or is it just too much full on all the time?
I actually never really thought about a lot of the things that I was doing. Very rarely do we sit down and really have a chat about it, especially now when we're not allowed even to go breakfast together or go for a beer.
So I found that certainly very useful as part of my training to start with, where this sort of open discussion was actively encouraged. So asking for help, for instance, was a sign of strength, because it means that people can help to solve the problem. You don't want to have the problem manifesting itself when there's an emergency, but also that open discussion where you can actually tell somebody that actually they're being a bit annoying when they do that, and it would help us all if they didn't hum that particular tune or whatever when you're trying to concentrate, but to voice concerns and to be open to that positive criticism. So when you actually decided that you would go into intensive care and really be confronted by all these very sick patients with COVID-19, did you think about yourself and the risk that you were putting yourself for at that point?
So actually, the risk of exposing yourself to the virus, but on intensive care, we have the full PPE. So as long as you're careful and you take the precautionary steps, you are very, very safe, actually. As long as I did what I was taught to do and was very careful about it, the risk of exposing myself in that way was extremely low.
Because, of course, that's exactly what the astronauts do. So we have all of this training simulated, hundreds of hours, and yes, you know exactly what you have to do. So on the day of the launch, everybody seems to think that must be a really scary time because you're sitting on top of all of this fuel that's about to be ignited beneath you and you're on a big firework. But actually, that's the day when there is nothing new to learn because you know what you have to do if in case of, and you've got plan A, B, C, and so on just in case. That's in many respects the most relaxing time. And for me, yes, the uncertainty of the training and particularly being catapulted into what was then the Soviet Union. It was towards the end of the Cold War. I was on a military base. Everything was so completely new and just unfamiliar. And the fact that they were standing on guard with their guns made me feel very nervous. And then, of course, learning Russian and all that unfamiliar stuff. By the time we'd gone through that and got to the launch day, I also trusted all those different teams because there's huge numbers of people involved in one space mission. And I guess very much like running a hospital, you're sort of, even though you might have your small ICU team.
Yeah, absolutely. And you rely on each other as much as anything. Everyone trusts everyone to make the right decision.
So, yes, it's that together you've minimised the risk. Whatever that risk is, the benefits outweigh those perceived risks. And for me, that I had the benefits of going into space and doing things I couldn't otherwise do and just having that amazing experience. But I really did feel as though everybody was working towards a single goal of getting a group of people into space and then back to Earth safely. But it's all what we push for, isn't it? So I can imagine it's the same in medicine. If right now we've really developed in what you're saying, that in ICU understanding, particularly when it comes to the lungs because of this virus, but that will help us with other things. And we will develop in areas that we think are important at the time. And it's the same in space. One of the things I loved doing was my favourite experiment as a chemist. My chemistry is my subject. And to be able to grow crystals in space is just a chemist's heaven. But of course, the crystals are all about designing better drugs back on Earth. I love that synergy. So we were born to have this conversation, I think.
It's so interesting how sometimes when you start talking about it, there's so many things when we say things, there's so things that just tick in the head that we're like, I completely recognise that scenario and that thought as well.
So a very exciting future ahead. It's been great talking to you, Derek.
Thank you, Helen.
That's Derek Yeung in conversation with Helen Sharman on the Hidden Strengths podcast. And do check out the entire episode. It's absolutely gripping and frank. The whole series is available on SoundCloud. Go over to SoundCloud and search for Hidden Strengths Pan Surge. So that's Pan Surge, Pan and Surge, S-U-R-G. And you'll find it really easily. And other episodes in that series feature the likes of BBC security correspondent Frank Gardner. Well, finally, to extreme morning sickness, or Hyperemesis gravidarum. Many women suffer morning sickness during pregnancy, but this condition is right at the top of the spectrum, where women vomit continuously, they can't eat or drink, they get dehydrated, they have weight loss, and they need to be hospitalised. To make matters worse, it's all too often just dismissed as regular morning sickness. But a real condition it is. We don't know exactly how many women are affected, but the figure is thought to be around 1 or 2 in 100, and it can keep women in hospital for anything from a few days to a few weeks. Nicolette Mitchell-Jones is a specialist registrar in obstetrics and gynecology. She's pregnant herself and also happens to be in that unfortunate 1 or 2% as she's experienced the condition. And Nicolette has led a study, just published, linking severe morning sickness with depression. She began by telling Maxine Myers what they did in the study.
We recruited women with hyperemesis from 3 West London hospitals, and then compared them to women who had not suffered with significant nausea and vomiting. We used something called the pregnancy unique quantification of emesis, called the puke score, to identify women that hadn't had significant nausea and vomiting. And then we asked them to fill out questionnaires assessing their mental health during pregnancy in the first trimester, and then after pregnancy. We also asked them about socioeconomic factors such as how much time did they have off work, and then we asked them about infant bonding because that has never been studied before in relation to hyperemesis.
What were the main things that you found then?
The main thing that we found was that whilst women are suffering symptoms, they are more likely to be depressed. I think we were quite shocked, so it was nearly 50% of them. I think the main finding is that depression or those feelings carried on after birth, so that women who had hyperemesis were more at risk of postnatal depression than women who had not had hyperemesis. There were lots of socioeconomic factors related to it, in that 53% of them had to take 4 or more weeks of sick leave, compared to just 2% of our control subjects. The other women in the hyperemesis group that weren't in paid employment were carers for children under 5, caring for a toddler whilst you're feeling as you are would be impossible. So they would need to rely on other relatives or other forms of childcare, which obviously has a social and economic impact.
What are the current guidelines in terms of how do we treat women with this condition, and how are they monitored then throughout their pregnancy?
At the moment, I would say we're still very much focused on physical management of hyperemesis. So we're not really assessing them for other things in terms of how is this affecting you mentally? Are you struggling at home? Are your family supportive? Because if you speak to women, lots of women's families aren't supportive because they don't understand what they're going through and how it's affecting them.
You talk about it being common. I mean, you've had your own experience of this sort of hyperemesis. Yeah. What was that like for you?
It was awful. My first baby, I think from about 8 weeks, I just continually vomited and felt sick and was in bed, in and out of hospital, bed-bound, housebound for weeks on end, crying. You're so upset when you feel, I'm pregnant, I've got a healthy baby, I should feel happy. And lots of women feel guilty for feeling upset and feeling these thoughts of terrible self-harm because they just can't carry on. But it makes you feel so miserable to be sat in bed and not able to do anything. You can't get out of bed, you can't go outside. And I will admit that I was definitely depressed.
Do you think change in our current guidelines need to happen then? What kind of changes would you like to see?
I would like to see that every woman is assessed for their mental health during their care, and also that the women are followed up rather than just being treated and discharged, because it's not like they have symptoms and then go home and the symptoms completely stop. The treatment might help, but they're still going to have symptoms when they go home. They need to feel supported. They need to feel there's someone they can call. My ideal would be a specialist clinic where there's a midwife they can call, who they know and who they can talk to, and who can refer them to appropriate services and arrange treatment for them if they need to. So specially designed services for this condition, which is quite common. I really think we're just not recognising it. In the trust I work in, we've just rewritten the guideline and incorporated a mental health assessment for every woman.
That's Nicolette Mitchell-Jones speaking to Maxine Myers, and that brings this edition to a close, but I can't go until I've given you the usual reminders of how you can find us, because where you want us, that's where you'll find us, basically. We're on iTunes, Spotify, YouTube and SoundCloud, and also Entail. And if you've not heard of that, you get visual podcasts. Yes, podcasts with pictures, and that's Entail. So check that out as well. All right, as for us, that will do for this month, but we'll be back in a few weeks' time with even more. So from me, Gareth Mitchell, and all of us on the team, thanks for listening and goodbye.